Hello and welcome to a cover story conversation. This week we are focusing on our health and also the stressful impact of urban living. I'm not just talking about the toxic air that we breathe every winter, we breathe it, but the impact doesn't just end in winter, because there are long term implications also. So, this is also a conversation where we're going to be taking a look at the long term implications of the toxic air and how the problem just doesn't end with the winter. We're also going to be taking a look at the stressful lifestyles, the rise. A lot of people are now admitting to depression, but should everybody take antidepressants off the counter? The problems of self medication. Now that there is an internet, everybody's become a doctor. How does AI help us, and how does AI help the doctors? And of course, the rage that is now Ozempic and Mounjaro, which is now also part of our, I think, the urban drawing room conversation. The stress to look good for the Instagram selfie has everybody self medicating. So I have with me a panel of very highly skilled doctors. I have Dr. Rommel Tickoo. He's the Director of Internal Medicine at the Max Super Speciality Hospital. I have Dr. Harsh Mahajan, Founder and Chairman, Mahajan Imaging and Labs. Welcome to this conversation, both of you. And Dr. Tickoo, first of all, how many, let's talk about the rising AQI. What are the complications? How many people are you seeing? And is the situation improving a bit?
Well, Priya, we've been seeing so many patients in the last 1 month because of the pollution, and it's a double whammy, the winter also setting in. And a lot of patients coming with sore throat, cough, cold, headaches, body aches, fatigue. It's not just the lung. We normally think pollution is just related to lungs, but it affects every organ in the body. And especially the elderly, the children, the ones who have chronic lung conditions like asthma, COPD, sinusitis, they're coming with exacerbations. A lot of cough, they need inhalers, they need nebulizers. Some patients need oral steroids. Some of them end up getting hospitalized. Quite a few ending up with pneumonia in spite of the vaccinations and all that we do. But it seems to be not getting better at all. The AQI is going higher and higher, and we don't seem to have any solution for this. And a lot of patients I've seen in the last couple of weeks with very high blood pressure. See, what the pollution does is that PM 2.5 enters the bloodstream, it narrows your arteries, and it leads to high blood pressure. And that, in
Oh,
fact, can lead to heart attacks, stroke. And in fact, I had very young people who came with very high BP, 180, 120. That's basically, according to definition, hypertensive crisis. They had nasal bleed because of high blood pressure. So quite a number of issues related to population. So it's not lung related only. So, but we are managing somehow, but the air quality doesn't seem to get better. So the key is that you take precautions indoors, outdoors. We normally think indoors the air quality is pretty good and outside it's bad. It's not like that. Outdoors, at least we should wear a mask, N95. It does give you some sort of protection against especially those fine particles. And please don't go out during the peak hours for morning walks and stuff like that. And at home also, maybe use air purifier with HEPA filters, have proper ventilation. There should be no dampness, mold in your walls. I mean, it makes sense to be at home, and the air quality at home is also good. So these are the
exactly.
precautions we should be taking.
Dr. Mahajan, your take on the AQI, and do you see it improving at all? Because you're also in on some policy decisions being taken. Any hope for us?
Well, you know, the numbers speak for themselves. And you know that things have been static. I mean, there may be a little fluctuation day to day, but overall, we are in the very poor to severe category since quite a few weeks. And of course, with the government taking whatever short-term steps it can, of BS6 vehicles only plying on the roads, those coming from outside being stopped at the borders, and whatever steps that can be taken in the short term are being taken. But overall, I think it has to be something more that needs to be done. Something, of course, in the short term, we need to act, but
Mm.
policy decision making, legal processes, which actually see that in the long term, in not just weeks and months, but in several years, this is controlled. And even though the government is supposed to do its bit and struggling as it may be, it's trying. But I think the onus equally rests on us as citizens of this country, as residents of Delhi NCR region. And not only Delhi NCR, I mean, if you look at the graph of pollution across the country, the entire Gangetic belt has very poor air quality. So, as citizens, we also need to do our bit, use our vehicles as little as possible. Even for a short distance, we tend to get in the car or on our two-wheeler and go. And, fire burning goes on across Delhi. Security guards you will see in your own colonies, I mean, as owners, as residents, we should be giving them electric heaters. We should be giving them warm clothes. Why should they need to burn, fires at night? So I think it has to be one awareness. I think awareness about the harmful effects. Dr. Tickoo has put it very comprehensively. We know that once the PM 2.5 and smaller particles get into the bloodstream, then every organ of the body is affected. And so we need to do our bit, whether it is, construction dust, whether it's dust on the roads. Just to expect the government to do everything, I think, would be
Yes.
asking for too much unless we do our little bit on our own.
But Dr. T, how long term is the impact? A lot of people feel that, chalo, December, Jan, we suffer, or, we go to the hills, you breathe in fresh air, everything is cleaned out. By summer, our lungs are clean. Does that work like that?
No, I don't think so. See, it's a cumulative effect. It's not a sudden damage to your system. It's a subtle cumulative effect over a period of years. It sort of unwires your entire physical and mental body shape. So over a period of time, you can develop chronic lung issues. On and off, you're exposed to very high pollution, COPD, asthma. It is linked to cancers also. You can develop lung cancer and other types of cancers as well. And apart from that, I also said about the heart attack bit, strokes. It has a link with Parkinson's disease, dementia, and even with metabolic disorders. It also increases insulin resistance, and which in fact can lead to diabetes, obesity, and dyslipidemia, high cholesterol, and that becomes a high risk for stroke, heart disease. So I don't think just because rest of the months, maybe 7, 8 months, we're exposed to a better air quality is any good for us. The fact that we are constantly exposed during these 3, 4 months to very high AQI will have its detrimental effect on our bodies, especially on the lungs of children and the elderly, the ones with chronic medical issues. Over a period of time, you'll realize that many people in Delhi are having chronic lung issues. So something, as Dr. Mahajan rightly said, something we have to do about it, especially the authorities have to take a hard call, whether it's strict pollution norms like vehicle emission norms, whether it's industrial regulation, whether it's spending more on public transport. I mean, I think we should take a leaf out of those cities which managed to curb pollution. They were equally bad, whether it's London, whether it's Tokyo, whether it's Beijing. We should understand what they did to get the things in order. Likewise, in Delhi, I don't think it's impossible. It's just that we have to put it all together and sort it out. Somebody has to really focus on it. I don't think it's a priority for anybody right now. So it has to be made a priority. And it's not something which cannot be done otherwise. So we have to focus on it.
And the onus is on us also to keep the heat on the government, because the minute the summer comes, we move on to other topics. But Dr. Mahajan, another, if you want to add something to this, but otherwise, I want to also ask you about the use of AI. But first, yeah, yes.
Yeah. See, even in summer, it's not as if we are living in a pollution-free environment. It's just that
It's
when we
true.
compare it to winter, we
Right.
say it's better, but it's always above 100, 150. And so, as has been said, it's the cumulative effect.
Mm.
Unless we act now, we will be facing an epidemic of health issues 10, 15, 20 years down the line. think of the children, the neonates who are being born now. What will be their state, not only of the lungs but all parts of the body? And if we have to be a developed country by 2047, and this is something that has been repeated ad nauseum, we have to be a healthy country to be economically, developed. So you don't want epidemic of not only lung cancer but lung diseases, interstitial lung disease, strokes, heart disease, what have you. Even it affects the kidneys. I mean, we are just talking of the major things. These subtle illnesses that it causes is something else, which probably we don't even factor into our scheme of things. So let's spend the money today rather than spend 10x, 50x the money 10, 15 years later and have a lot of sick people in our country, especially in the northern parts of the country. So the time to act is now.
That's true. I think that's a very good point you made, and I totally correct. In the summer, the pollution levels, because our bar is so low that we feel, chalo, 600 nahi hai, 400 nahi hai, to theek hai, but it is not theek hai, end of the day.
I can also tell you that, many people come to our centers for getting their CT scan of the lungs done. And we randomly actually looked at 5,000 CT scans which were done in 2024 in our centers. And what we found was actually very disturbing. We found that young people, of course, they had a CT scan done for other reasons, for pneumonia, for infection, for other stuff, that we were finding chronic changes in the lungs, which you usually find at 60, 70 years of age. And these were people in their 30s and 40s. So to say that the lungs become okay during summer and it's only in the winters that things happen, it is a unrelenting cumulative effect of adverse
Yes.
changes in the lungs which happen year on year. And the same will go for every organ in the body because the dust particles are very, very deleterious to our health.
That's a good wake-up call, and I do hope the authorities are watching this program. But moving on, Dr. Tickoo, you also wrote a very interesting article I saw on the remaking of the family doctor, and I think you spoke
Yeah.
about how self-medication and
Yeah, yeah.
people are looking at Chat GPT. How harmful is that and detrimental?
Well, see, you have to use it judiciously. If it's for awareness, I'm all for it. But you can't be diagnosing your medical issues with ChatGPT or doing self-medication or coming back to doctors and then quizzing them, trying to see what they know, what they don't know. So you have to use it to ask your doctor questions which make sense. Like you have a disease which you don't know much about, so you read about it. You
Right.
read what questions you should be asking the doctors, so that it's a fruitful discussion with your doctor, so that you don't miss out on stuff which you need to know. But it's not, see, otherwise what it can do is it leads to too much of fear, too much of anxiety, over testing, doctor shopping, going from one doctor to another, unnecessarily doing stuff which you should not be doing. And you can't replace doctors. See, we've been doing this for years now, decades now, and that human touch is what actually matters. And sometimes you just look at the patient and you can figure out what is wrong with him. Just an intuition. So Chat GPT and AI can't do that. But having said that, yeah, it give you a platform to sort of gain more knowledge, know about things which otherwise would be difficult to get hold of. We also use it sometimes, not for medical stuff, but for other reasons. But yes, it should be used judiciously. You can't be doing self-medication, diagnosing them. Now, patients come to OPD with, I did this is what I found, this is the medicine that I took, but it's not working. They've already done half of the
Medicine.
treatment investigations. They come with the CT scans. They don't even know whether it's really required, not required, what are the side effects of this. And the same goes with other newer medications now regarding weight loss, the newer medicines which we've been talking about, the injections. Everybody's doing Chat GPT. They look at the celebrities who lost weight and they come and then they feel, oh, this is what it does, so let's move on to this drug. And they come and sort of pressurize us to prescribe the medicines for them. But at the end of the day, it has to be used judiciously, and you shouldn't be going by what is written there. It's not carved in stone. You have to have a good discussion with your doctors.
On this. Okay. I'm going to take a break and come back to Dr. Mahajan, because he and I, we've been also talking about with Dr. Tickoo also the good uses of AI and the net also. But I first want to focus on the negative part, but after a quick break. So stay with us. Hello and welcome back to our cover story conversation. This week, we're taking a look at your health, especially for those who are living in the urban cities, the stress and the new age lifestyle diseases that come with it, and also some pitfalls. Dr. Mahajan, we talked about the good use of AI, but also, just if you can just comment on what Dr. Tickoo just red flagged also, the dangers of self-medication.
See, that is very evident. With limited knowledge and with the help of, Chat GPT or Gemini, all these other AI tools that are now available to each and every one, self-medication we've known forever is not good, because with limited understanding, if you start taking medicine, and unfortunately, in our country, we are even able to get restricted medications, over the counter without a doctor's prescription, despite all the,
Yeah.
policing that is being done and the things that are in place. So that is never good, because with limited understanding, I mean, if you open, if someone has headache and you open, it'll have all kinds of causes that will be listed. And one, tends to raise your tension that could I have cancer? Could I have a tumor in the brain? So like Dr. Tiku said, for educational reasons, for self-awareness, it's fine. You need to know what problem you have, or someone is diagnosed with a certain disease. Studying about it, there's no problem. But if someone thinks that based on one's study on the net, one can actually start treating oneself, then I think one is mistaken. Things will only go south. Now, about AI, otherwise, I feel, especially in the years to come, judicious use of AI by healthcare providers, by doctors, can be useful, provided these are AI algorithms which have passed all the certifications, like US FDA or our own CDSCO, CE marked, and they are for niche applications as things currently stand. There is no omnibus AI algorithm that's available, which you feed in some data and it'll give you. AI algorithms can hallucinate. They actually pick up from whatever data that's fed to them. So, for a doctor who understands and who's able to make judicious use based on their own knowledge and experience, I think it can be useful in the months and years to come. But for patients, for self-medication, not at all. And the hallucination that occurs, AI just makes up things which never got published, which and when actually people have interrogated the developers, and actually if you interrogate AI itself, it says it has to give an answer, and it wants to make you feel good. So I mean, there are so many things from deep learning to large language models to agentic AI, where it is able to reason as well. I mean, we are moving very, very fast, and one has to be cautious. One has to use it judiciously, and one has to use it as a tool and not actually be ruled by it. If you think that even a doctor can use it and go by what it's telling 100%, that would be absolutely wrong. It can be an assistant. It can't be your master.
Nicely put, very nicely put. But let's talk about the two villains of the piece, really, statins and steroids, Dr. Tikku. A lot of people feel hesitant, even though we are popping antibiotics by
Hmm.
the sweets, but statins and steroids, everybody says no, no, chodo, let's avoid.
See, with statins, there's a lot of misinformation. I've said it in the past also.
And
Statins are life-saving drugs, especially for those who are at a high risk of stroke, cardiac issues, heart attacks. See, if you're a smoker, if you have a very strong family history of heart disease, you're a diabetic, there are high chances that you'll end up with a cardiac event or stroke. So you need statins for sure, especially if your LDL, the bad cholesterol levels are pretty high. So the myths which are associated with statins are that it sort of gives you body aches, myopathies, muscle issues, which is something which just is temporary, very mild, happens to very few people. Then there are myths about liver disease causes, in fact, it improves fatty liver. It doesn't cause mild elevation of liver enzymes in rare instances, again, doesn't mean much. Then that it causes dementia, degenerative neurological issues, nothing like that. There's no evidence to back that. Then again, the fact that once you're on statins, you always have to be on statins. That's not a rule. It's the risk factor which defines that. Now, if you're obese and you have lost weight or your sugars are under control, probably we can reduce the dose or maybe even stop the statins or give you a non-statin. There are other many drugs now available. It's not just the statins. So we have other, in fact, injectable options also. But statins by far are the gold standard. They save so many lives, millions of lives all over. We don't look at that. We just focus on those one or two odd side effects. So a lot of misinformation regarding statins, which I don't agree with at all. Because over the years, I've seen what statins can do and how protective they are for certain section of patients. Regarding steroids, again, if used for the right indication, for the right disease, yes, they work wonders because there are enough indications for steroids. Now, they should not be abused. One should not, take them over the counter without medical supervision. And also, it's not a stopgap that you want immediate relief from maybe some cough, cold, and you take steroids. No, that's not an indication. But yes, if you have acute bronchitis, a lot of bronchospasm, spasm, chest issues, or if you have autoimmune diseases, certain cancers, rheumatoid arthritis, steroids are the treatment. They save you. So let the doctors decide. You need to have faith in the doctor. Once you've gone there, you discuss with him in detail, but just go with what he's saying. He knows better what is good for you, what is not good for you. He will discuss with you the pros and the cons, what are the side effects, what are the side effects. Is it better to go with the drug, not go with the drug? Will the disease itself give you more trouble than the drug? See, the problem today is that every patient who comes to me with uncontrolled sugar, who's on oral tablets, doesn't want insulin. It's the standard norm in India. Nobody wants to be on injectables. Everyone wants tablets. And there's a failure of oral drugs. Their sugars are 300, 350, and they don't want insulin. So it takes a while for me to really convince them that they really need it. Otherwise, their organs will get affected. There'll be kidney damage, eye damage, heart issues. So, see, we have to change the concept of people. People don't want to, they read something about certain drugs, certain issues, and then they just hang on to it. So let the doctor decide whether it's steroid, whether it's statins, or whether it's Mounjaro or Ozempic. See, those are basically drugs meant to treat metabolic disorders like
diabetes.
diabetes and obesity. And they work wonders for somebody whose life is getting totally affected by obesity, who's not able to walk, is morbidly obese, has uncontrolled diabetes, uncontrolled hypertension, sleep apnea, is lethargic, is sleeping through the day. I mean, it is a boon for such a patient. I would definitely advise him to take it. And a lot of my patients have been on these drugs and they've lost quite a bit of weight. And even their sugars are under control. The fatty liver reverses. A lot of benefits, but not for vanity or for cosmetic reasons, just because you want to look good. Then the side effects will take over. Because if you don't have too much of fat, then it will take care of the proteins. Then you have those faces, which Ozempic faces you talk about, or then the gastric side effects, which you anyway don't need because you need to shed those maybe 4-5 kgs. And that also may be not important at some point. Let the doctor decide. And dietary changes, exercise, lifestyle measures is enough to shed that 5 to 7 kgs. So let the doctors decide, I would say. Any drug, whether it's statin, steroid, or Mounjaro, whatever it is, weight loss, let the
Yeah.
doctor decide whether you need it or not.
I think let the doctor decide is, I think, the very good advice to take away from. But Dr. Mahajan, your take on these two villains of the piece, really?
See, I have friends who've been on statins for 30, 35 years, starting at 35 years of age. So
Mm,
statins have been around for nearly 40, 50 years. And if they were so villainous, they would have been stopped.
correct. Mm,
They really help in lowering the bad cholesterol, the LDL, and over the years, the guidelines have also changed to bring the LDL levels even lower, especially in those that are at high risk for heart disease. And now, when we do CT angiography in those who may have suspected coronary artery disease, if we find even 10-20% narrowing because of lipid plaques, then the guidelines say that we need to even dramatically further reduce the LDL. It used to be said that you bring it below 70 if someone is on medication. Below 100 without medication is fine, is normal. Now, instead of below 70, they say you can even bring it to below 55. In fact, the good cholesterol, the
mm,
HDL versus the LDL, the bad cholesterol should be 1:1. And as Dr. Tickoo pointed out, we have other drugs available as well,
right.
which can be given in combination with statins so that you don't need to give a very high dose of the
Statin.
statin to achieve the same end goal. So, statins, life-saving, even in acute situations. When someone comes with a heart attack, statins can be very, very useful. Then steroids, again, you know, people say, no, no, this doctor's prescribed steroids. I won't take them.
Yeah.
The doctor knows why he or she has prescribed steroids, and they are life-saving, both in chronic diseases when given. Of course, it has to be given in a certain form. The dosage has to be titrated. You have to bring the dose down steadily over time. And even in acute situations, steroids are very useful. In allergic reactions, it may be the difference between life and death. So, of course, given long term, and as it used to be, we had some of these, so-called homeopathy practitioners who were actually not true homeopathy practitioners. They would mix steroid in the drugs, in the powder that they were giving for asthma. In fact,
Mm,
my mother had it when we were young for several years before we realized that these
yeah,
were
steroids.
steroids. So, long-term steroid use may cause problems, but there are certain diseases under medical supervision, you may have to take it long term. So it has to be regulated, it has to be under medical supervision and not
Mm,
on one's own. And then about these newer weight reducing drugs, Mounjaro, Ozempic, here again, you can lose about 20% of body weight in nearly 85, 90%. People tend to lose weight. But as also very rightly pointed out, it is for those with morbid obesity. It is for those who are diabetic. If those who have some increased weight and don't have diabetes, if it is done for cosmetic reasons, then it's going to be a problem because you can also lose muscle with it,
mm.
uh, and also the yo-yo effect. Someday you will have to
Yes.
stop using it, and then if mentally you're not there,
Mm,
then the weight is going to come back. In fact, it may even overshoot. And the long term side effects, 5 years down the line, 7 years down the line, 10 years down the line, what is going to happen? We need to actually keep a look on that as well. So, for those who deserve it,
give it.
uncontrolled diabetes, morbidly obese, where it is the drug of choice. But for the others, and especially people who come to doctors and want to force them to prescribe it, I think they are living a dangerous life.
On that note, thank you so much, both of you, for this really wake up call. And we wish you a happy new year and hopefully better health next year, better luck. But I'll have you both back again. Until then, wish you both a very, very happy new year. Thank you.
Yeah, thank you.
Thank you so
Thank you
much.
so much.
Thank you.